Have you ever wondered why some older people walk every day very diligently, yet their legs still shake when they stand up, they still struggle to climb stairs, and they are still afraid of falling? You see them in the park, around the neighborhood, or maybe that person is you. They walk regularly. They never skip a day, but their body does not seem to get better. Many people believe that walking is enough, and that the more you walk, the stronger your legs will be. But the medical truth is not that simple. My name is Dr. James Anderson. I specialize in explaining health and movement changes as we age. Today, there is one important truth I need you to understand. It is a truth that surgeons, physiotherapists, and movement researchers all know well, but very few older adults are ever clearly told. Walking is good for your heart. Walking improves circulation. Walking helps clear the mind. But walking alone is not enough to keep your legs strong after the age of 65. It is not enough to protect you from muscle loss, poor balance, and falls. From a medical point of view, this is not an opinion. It is basic aging physiology. After the age of 60 to 65, the body begins a process called sarcopenia, which means age-related muscle loss. Each year, without the right type of stimulation, you can lose 1 to 2% of your muscle mass, especially in the weight-bearing muscles of the legs. The key problem is this. Walking only uses a small portion of your leg muscles, and it does not place enough load on them to make them stronger. This leads us to the first cause. Cause 1. Walking does not activate the muscles that weaken the fastest. When you walk, your body works at a light and repetitive level. It does not require strong effort from the front thigh muscles. It does not require the glute muscles to lift your full body weight. It does not challenge the hips and knees to stabilize in difficult positions. Because of this, the most important muscles for standing up, climbing stairs, and maintaining balance are not trained enough. What is the result? You may walk for 30 to 60 minutes every day, yet you still need to push with your hands to stand up. Your knees may shake when going up or down stairs. You may lose balance on uneven ground. This is not because you are lazy. It is not because you are weak because of age. It is because your body has not received the correct signal to build strength. Cause 2. After 65, muscles need resistance, not just movement. In movement medicine, there's a very clear principle. Muscles only become stronger when they work against resistance. Walking mainly trains endurance. Endurance does not stop muscle loss. After the age of 65, if you only walk and do not practice movements such as standing up and sitting down, rising onto your toes, or lifting the legs with control, your muscles will continue to weaken each year, even if you are very committed. This is why surgeons often see patients who walk regularly, yet still fall, still break bones, and still lose their independence earlier than expected. If you're experiencing any of these problems, leave the number 1. Please share this video with someone you care about, so they also have a chance to improve their quality of life. I wish you strength and peace on your journey. Right now, I will continue by explaining the important symptoms and the underlying physiological mechanisms so you can understand what your body is truly lacking, rather than simply believing it is just old age. Now, I would like you to pause for a few seconds and ask yourself an honest question. Over the past 6 to 12 months, have you noticed any of the following quiet changes in your body? Not severe pain, not a sudden illness, but small changes that are very important from a medical point of view. Symptom 1. Standing up from a chair is getting harder. In the past, you could stand up easily. Now, you may need to push with your hands, use momentum, or stand up slowly and feel unsteady. From a physiological point of view, this is a clear sign of weakness in the thigh muscles, the glute muscles, and the muscles that stabilize the knee joint. Walking does not train the action of standing up. Your body is slowly losing vertical strength, which is the strength needed to stand, sit, and climb stairs. Symptom 2. Shaky legs or unsteadiness on stairs or uneven ground. Many people say, "I can walk just fine, but I feel scared when I go up or down stairs." The problem is not your heart. The problem is weakness in the lower leg muscles, the ankle muscles, and the deep balance system. After the age of 65, the small stabilizing muscles weaken faster than the larger muscles. When they weaken, the brain receives a signal that movement is unsafe. As a result, you begin to walk more carefully, more slowly, and with less confidence. This is the beginning of falls. It is not clumsiness. Symptom 3. Shorter steps and feet not lifting properly. Have you noticed that many older people begin to shuffle their feet and no longer lift them clearly off the ground? This is a typical sign of weak hip flexor muscles. These muscles are responsible for lifting the leg when you step, preventing trips, and stepping over obstacles. Regular walking does not activate these muscles enough. That is why, even if you walk every day, your walking pattern can slowly worsen over time. Symptom 4. Tired legs, but not because of the heart. Many people think, I feel weak because of my heart. But in many cases, the heart is working well. The real issue is that the leg muscles are not strong enough to support the body. When muscles are weak, the brain has to use more energy. The nervous system works harder. You feel tired more quickly, even after short distances. The underlying physiology you need to understand. Many people accept these signs and say, it's just old age. That is not entirely true. The truth is that your body is missing the signals it needs to repair and maintain muscle. After the age of 65, muscle-building signals decrease. Growth hormone levels decline. The nervous system activates muscles less powerfully. Without the right type of stimulation, the body keeps muscles at a minimum level, saves energy, and slowly accepts weakness as a new normal. But this is not your destiny. It is a biological response that can be reversed. If you recognize one or more of these signs, comment with the number 1. Not to worry, but to begin understanding your body correctly. And now, I will show you how the body can respond and adapt naturally without medication, without heavy exercise, using only physiology and solid medical evidence. Now that you understand the symptoms and the physiology behind them, I want to reassure you of one very important thing. The human body is designed to adapt, even at the age of 70, 80, or 90. The problem is not that you are too old to get stronger. The problem is that your body has not been receiving the right signals to recover and rebuild. In movement medicine, there are 3 core principles for improving leg strength after the age of 65. Reducing low-level chronic inflammation, activating the correct muscle groups that have been neglected, restoring the connection between the nervous system and the muscles. When these 3 things are done properly, the body adjusts in the most natural way. Principle 1. Reduce silent inflammation so muscles can recover. Low-level chronic inflammation is one of the main reasons muscles recover slowly, joints feel stiff, and legs tire easily. You do not need strong medication. You need to reduce inflammation through daily habits. Practical steps include drinking enough water, about 1.5 to 2 liters per day if there is no medical restriction, eating more oily fish, eggs, and dark green vegetables, and limiting refined sugar and fried foods. When inflammation decreases, the body's muscle-building signals can work again. Principle 2. Activate the protective muscle groups that are often missed. Your body does not need heavy exercise. It needs the right muscles trained in the right way. There are 3 key muscle groups. The thigh and glute muscles, which help you stand up and sit down. The calf muscles, which stabilize the body and help push each step. The hip flexor muscles, which lift the leg and help prevent tripping. Safe and effective movements include sitting down and standing up from a chair, rising onto your toes, and lifting one knee at a time while standing or holding support. Move slowly, with control, and without pain. Stop if you feel dizzy or unsteady. These movements provide the biological signals that walking alone does not give in sufficient amounts. Principle 3. Restore the nerve, muscle connection. Many people do not realize that after the age of 65, the brain sends weaker signals to the muscles if they are not regularly activated. When you practice movements that are controlled, involve balance, and clearly lift the legs, you're teaching the brain how to use the body properly again. This is why, after just a few weeks, many people notice steadier walking, faster reactions, and less fear of falling. This does not happen because you are becoming young again. It happens because the nervous system has been reactivated. Why do these adjustments work? Because they directly counter the effects of aging. Aging reduces signals, so you increase them. Aging causes muscle loss, so you stimulate muscle building. Aging reduces control, so you retrain the nervous system. The body responds to signals, not to age. If you would like me to provide detailed, step-by-step guidance for each exercise, please follow the channel and comment with the number 1. Next, I will summarize everything and explain how to maintain results long-term, without stopping halfway, without exercising incorrectly, and without falling back into the cycle of weakness, fear, and reduced movement. Before we finish, I would like you to pause for a few seconds, not to memorize every exercise or every number, but to look at the full picture of health we have just gone through. Because the most important thing to take away is not an exercise, but a scientific truth. The body does not become weak because of age. It becomes weak because it no longer receives the right signals. And today, you have seen that very clearly. Summary of the 5 most important points. First, walking is good for the heart, but it is not enough to keep leg muscles strong after the age of 65. Walking builds endurance, not protective strength. Second, signs such as difficulty standing up, shaky legs on stairs, tripping easily, or fear of falling are not simply because of old age. They happen because the body is not activating the right muscle groups. Third, the 3 muscle groups that determine independent living are the thigh and glute muscles, the calf muscles, and the hip flexor muscles. When these muscles weaken, everyday activities become more dangerous. Fourth, natural, physiology-based adjustments, such as slow and controlled movements, reducing inflammation through lifestyle and restoring the nerve-muscle connection, can reverse weakness even at an older age. Fifth, strength is not for showing off. Strength is for living safely, independently, and without relying on others. A simple scientific message. In medicine, we often say, if you do not use it, you lose it. But the good news is this. If you use it correctly, you can rebuild it. Muscle can grow at any age. This is not motivation or encouragement. It is a fact proven by hundreds of clinical studies. Clear action. Start today. You do not need a gym. You do not need expensive equipment. You do not need to exercise until exhaustion. You only need 3 to 4 days per week, 15 to 20 minutes per session, and a focus on quality. Start slowly, start safely, and start now while you still can. If you would like me to go deeper into each exercise, provide step-by-step guidance, and show how to adjust for knee joints, back issues, or blood pressure, please follow the Dr. James Anderson channel and comment with a number 1 so I know you are here. And remember this, health is not found in a medicine cabinet. It is built through your daily habits. I look forward to seeing you in the next video. Wishing you strength, stability, and many years of independent living.